Good morning. This is Sam Haynes with the City of Austin, and I will be moderating this virtual media availability. And this morning we have Dr. Mark Escott, Interim Austin Travis County, and pool reporter Daniel King from KUT. Dr. Escott, whenever you're ready to provide opening remarks, please go ahead.
Thank you. Good morning, everybody. On Monday, I issued enhanced and updated control orders for nursing homes, and I want to explain a little bit about that. Back when we first declared a disaster in the city of Austin and Travis County, we quickly thereafter took action to secure nursing homes. That included access control. It included screening at the doors of nurses and staff and visitors, as well as patients. And it also required reporting of those cases to Austin Public Health immediately. But unfortunately, as we've seen across the country, these measures weren't enough. And that required us to think about how we might be able to protect these facilities further, because they have been and will be the most vulnerable to this disease. And again, because of that, we issued these new orders in an effort to really enhance that protection, enhance those defenses to protect our elderly population in these facilities. So I want to mention a few elements of these new enhanced orders. One of those elements is it requires that these facilities notify patients, families, and staff anytime there's a case at that facility. It also requires that restrictions happen for those facilities that are experiencing outbreaks. In those circumstances, nursing homes and other long-term care facilities will be restricted from receiving new patients, and they'll be restricted from receiving returning patients to those facilities until that outbreak is under control. And finally, a new element that we have not seen before across the U.S. and certainly the state of Texas is this concept of a nursing home strike team. So these strike teams are designed to add personnel. That includes clinical staff such as clinicians and nurses, nursing assistants, medical assistants, but also support staff like maintenance workers and kitchen workers, so that we can help these facilities that are struggling. Remember that not only are patients or residents getting sick, but also staff are getting sick. And that means staffing shortages are mixed with increasing populations in these facilities of patients who have more needs. And that imbalance is only contributing to the furthering of the spread of the disease in these facilities. So we're hopeful that these strike teams will be able to help augment those resources, help secure those resources and the individuals residing there, and really help to get these outbreaks under control very early. To date, we've had 8 outbreaks at nursing home facilities. As we reported earlier this week, that includes 96 residents as well as 67 staff, including 15 deaths of residents and at least one healthcare worker working at one of those nursing homes who has died as well. This is very concerning for us. It's concerning for us as a state. It's concerning for us as a country, and we have to do better. We're trying hard. We're learning every day about new methods, new techniques, new information and data regarding this outbreak. And because of that, we have to continue to refine our efforts, particularly aimed at cocooning those who are most vulnerable. And that includes these nursing home residents, assisted living facility residents. It also includes those who are at risk in the general community. And we are committed to continuing that evaluation process, enhancing our methods, and looking for new and innovative ways to do that. I think it's critical for us to really take what we're doing and make recommendations as well to the state. As I mentioned earlier this week, we've asked for these resources for the strike teams from the state, and they are working on those items. That includes 4 strike teams for our top 4 facilities that are experiencing outbreaks. But there are going to be other facilities, both locally and across the state, that are going to need support. And the state is working hard on identifying those resources. Those may be state-level resources. Those may be federal resources. But in the interim, while they are still working on identifying those resources and how to deploy them, we are looking to contractors locally so that we can supplement the staffing and get these facilities as much as support as possible, including PPE and other equipment that they need. On that note, I'm happy to take questions.
Hi, Dr. Escott. This is Samuel King with KUT. The first question is from KView, and it's, can you explain or elaborate on the lack of specific information we're receiving about nursing homes, including locations of facilities and corresponding cases? Other jurisdictions are releasing that data. Why isn't Austin at this point?
So the laws regarding privacy of information like this are going to vary state to state. We've had regular communications with the Department of State Health Services and with our city attorney's office, and they all agree that this is protected information under Texas law. I know there's a lot of desire to have lots of details regarding this kind of information, but it's also important to note that privacy considerations are important. I'll tell you that we've had requests from a number of individuals regarding other types of facilities, regarding wanting to know addresses of individuals in neighborhoods where COVID-19 cases were. And we have to be very, very careful on releasing this information because it really has to be for a public health need, not just a desire to have it. In the circumstance that I described of our new control orders, it requires nursing homes and other facilities to notify individuals of outbreaks who are at risk. If we get any indication that the facility is not able to provide that information in a timely fashion, then we may consider public disclosure at that stage, similar to what we did earlier this year with measles. When people need to be notified in a timely manner and we don't have the ability to do that, then we have to go to public disclosure to achieve that goal.
Okay, the next question is from CBS Austin, and it's yesterday you told the City Council that Austin would need to remain vigilant against COVID-19 for probably at least a year. What do you envision that vigilance looking like, specifically when it pertains to work, school, and festivals such as ACL?
So I think a baseline expectation should be that this concept of social distancing, the personal hygiene, the public masking or public facial covering is going to have to continue until we reach herd immunity by one method or another, and that would be primarily through a vaccination. We don't expect that vaccination to be available publicly at least for a year. So there's going to have to be at least some measures to continue that effort at decreasing rates of transmission in the community. What it looks like as far as what's going to be open or not is a little too early to tell in the long term. I can tell you that when we look at the modeling and the predictions and the associated risk associated with different activities, at the heart of that is person-to-person interactions. So if there are events like sporting events, like festivals, where there are lots of person-to-person interactions, particularly within 6 feet, particularly when it's people who are not related, that's going to substantially increase the risk. So I can expect that at least for the next 6 months and perhaps the next year, that events like that are going to be very, very difficult to have unless we have substantial increases in testing and other strategies to further mitigate the threat of those kind of events.
This next question is from Spectrum News. What steps are being done to protect some of the city's most vulnerable residents? You've mentioned nursing homes, and you can expand out to some other vulnerable populations. And do you believe is enough being done currently?
Well, again, we're continuing to assess the situation when it comes to vulnerable populations. Some of them live in particular places, like nursing homes or assisted living facilities. So it may be easier for us to structure interventions in that regard. We are working closely with our experts from homelessness to address the needs of homeless individuals and others who are at the threat of homelessness. We have implemented the protective lodge to put individuals who are experiencing homelessness in a place where they can be separate from others to try to protect them. We've got the isolation facility also to try to protect those from exposure. But, we also have people who are vulnerable in their own homes, those who are over the age of 60, those with substantial underlying health conditions. And, again, for the next year, that we're going to have to continue to cocoon those individuals as well. So even when we start reopening things, our advice for those individuals who are at higher risk for hospitalization, for complications, and for death are going to be more stringent than for the rest of the community. And that really is an effort to continue to cocoon them, even though some aspects of society are going to begin to open.
Okay, Dr. Escott, and these next few questions regard staffing, so I'm going to sort of group them together. First is from Community Impact. Could you explain a little more about what efforts are currently underway to boost staffing at nursing homes, what level is needed, and can we realistically expect resources like the National Guard to be deployed?
Well, again, we're working with the state through a request process for resources. The state is working hard, looking at state resources, and I'm sure they're looking at federal resources, including National Guard, to perhaps fill those holes that are needed to be filled. We have also made the recommendation that we look at increasing the staffing across the board for nursing homes and long-term care facilities. These facilities have suffered for years with lack of staffing. And that has to do with lack of funding to support staffing. And it also has to do with a lack of general interest in the healthcare community in working in these facilities. So we have to create some opportunities for career development and growth within this industry for staff, including nursing assistants and medical assistants. And we've got to look at pay options. It's got to be attractive on the pay scale to ensure that we are recruiting people and retaining people into those positions. Quite honestly, infection control at nursing homes has been a challenge for us for years. And part of that has to do with this constant struggle at staffing. It's hard to have proper infection control if you have a substantially high number of residents and a substantially low number of nursing staff or support staff as compared to like a hospital setting.
In terms of availability of staffing, this question is from Estonia. Has the state emergency rule to temporarily allow more nurses aides to serve nursing homes had a positive impact on staffing so far?
I'm not sure if it has yet, but I'm sure that it will as we go forward. Again, I think there's going to be additional needs for some time now for medical assistants, for nursing assistants, for nurses to really help fill these gaps. I think the community college efforts at making these types of programs more readily available will certainly serve us well, even in the short term.
This question is from a Sayer at KUT. Do any of the staffers at the nursing homes with suspected clusters work at other facilities, and has that impacted the spread?
That has been a factor in some of our outbreaks. We're certainly discouraging the working at different facilities, particularly involving those facilities with COVID-19 outbreaks. But quite honestly, there is some concern that if we completely restrict the ability to work at multiple facilities, we will not have enough staff to staff facilities. And this is why we're asking the state for new staff, for staff who don't normally work in nursing facilities, to help fill these gaps so we don't have a domino effect into other facilities. Again, this crisis has been going on regarding nursing home staffings long before COVID-19 showed up. And I think COVID-19 is certainly highlighting some of the vulnerabilities that have been present for quite some time.
This next question is from KXAN, and they ask, congressional leaders tell us the lack of transparency regarding which facilities have confirmed cases is leading to unreported cases and even deaths. How do you respond to that? Do you think that may be happening in our area?
Well, again, since the beginning of this outbreak here, we've required the notification. I haven't received any information from anyone suggesting that people are hiding cases. That is against the law. There is a criminal penalty associated with intentionally concealing cases of an outbreak. Again, I understand the congressional concern about this, but if we can effectively reach out to those who are at risk, and that includes patients, that includes family members, that includes staff, then I don't believe there's any need for public disclosure if that can be reasonably achieved by that facility.
Okay, I'm going to combine a couple of questions here from Fox 7 Austin and CBS Austin, and they both regard to strike teams. You mentioned they haven't been deployed just yet. You said there are 8 COVID clusters, senior living communities, but you're prioritizing 4 of those clusters by requesting strike teams first. Maybe if you can't say where are the high priority clusters, what's the highest number of patients at a single location?
Sure. So, again, we're prioritizing those with the largest outbreaks at this stage. We do have one facility that has more than 35 residents who have been infected, and a number of staff as well. So these are sizable outbreaks, and that's one of the challenges that we have here and across the country is that once COVID-19 gets into a facility, it's becoming very difficult to control it at that stage. That's why we're trying to really get resources in quickly in future outbreaks so that we can get quick control. But primarily, we want to reinforce the defenses of those that do not have COVID-19 yet. Because I think that if we can prevent it from ever getting in the door, we're going to be much more effective at managing this situation as a whole. I will say that last week I issued a control order for one nursing home facility mandating the testing of all staff, and we're expecting the results back of that staff testing this week, and we may have further information to share later this week.
Okay, thank you for that. This question, again, from community impact, and it mentions testing, and what does, there's reports where Travis County has a higher rate of testing per capita than other Texas counties. Are we doing anything differently, and can we realistically get to the sort of recommended numbers of 1.5 tests per 1,000 residents per day?
Yeah, so it's the challenge that we've had so far in all the cities across Texas is the limitation on numbers of tests. If you recall, we initially had limitations on the reagent, then we had limitations on the ability to run the tests, and now we have limitations on the test collection kits. So other jurisdictions, particularly those that are larger, need a larger number of kits and tests to be run to reach that same ratio. So it's been a numbers challenge for many jurisdictions. I'm happy that we've been able to continually increase our testing here, but we've got a long way to go. We look at some of the recommendations, and there are a number of different recommendations regarding how many tests we should run. Based on the Harvard recommendations, we would need to run close to 2,000 tests a day to reach the goal that they suggested. There are a number of factors that are going to determine that goal, and we're continuing to look at studies and advice regarding where we want to set our goal, but we do have a long way to go.
As a related question for us here at KUT, sort of what level or rate of testing would you feel comfortable about advising a sort of a further relaxing of the stay-at-home order in Austin, Travis?
Well, I think the question of when to return to work and to what level really depends on a number of factors, which include testing. Testing is one piece. We certainly want to see the positive rate drop below 10% and stay below 10%. But there are other factors involved. That personal protective equipment availability is a significant factor. Our ability to contact trace effectively is a significant factor. Our healthcare capacity is a significant factor. And also that aspect of cocooning, how well we can cocoon those who are at higher risk. If we can effectively cocoon people and prevent those who have a higher risk of being hospitalized or needing a ventilator or dying, then we can have more transmission in the community without as much effect on that healthcare system. And there are other factors that are going to be involved, as I mentioned earlier, in the long-term ability to keep things open, including identifying an effective treatment and identifying a successful vaccine.
And in terms of, back to the nursing home situation for a moment, is there an update on the isolation facility to say how many residents have been transferred there? That question's from KXAN.
I don't have the information on the current residents. That facility is in place. They have received residents who've been discharged from the hospital with COVID-19, and we can arrange for some reporting on that later this week.
And a question again from Estonia. How are recoveries being defined and tracked in the public dashboard, i.e. is it connected to hospitalizations or overall confirmed cases?
So the recovered numbers that we report are based upon recommendations from the CDC regarding the clearance process. So when we have somebody who has passed their initial 14-day window, they'll start getting phone calls and we'll start the clearance process. If they've been sick for, or they've recovered for 3 days past when they last had a fever or a cough, they're considered recovered. And there's a number of other factors based on that CDC clearance process that we utilize for clearance. Once that they've been identified as recovered, then we discuss with them the opportunity to donate plasma. And if they are interested in that, we refer them to We Are Blood to enter in the convalescent plasma program.
At the moment, that is all the questions we have from the media.
Thank you so much. Again, I want to reiterate that we are working hard to really strengthen defenses of our nursing homes and long-term care facilities. We're continuing to look to innovation, look at other models in other cities, and we have to be vigilant and continue that effort, continue to enhance those capabilities. And that also depends on the community. It's critical that we as a community continue to practice social distancing. We continue to wear masks or facial coverings in public. We continue that hand hygiene, washing our hands frequently, not touching our face, and certainly not going out if we're sick. The more we can engage in that, the better we're going to weather this storm, and the longer that we're going to be able to keep businesses open. So we certainly appreciate the community's effort. You've all done a great job so far, and we need to continue that vigilance. Thank you so much.
Love got too high.